It is time now for Doc Talk. We are getting answers to your medical questions, and we're starting with the big game. But first, we want to make some introductions here. We have Dr. Leo Lopez joining us from University Health. Thanks so much for being here.
Happy to be back.
Okay, so let's first talk about Super Bowl Sunday. What are some tips for healthy eating on the day of the big game?
That's right. We're a few days away from Super Bowl Sunday, and I imagine folks are getting ready, might be hosting a few friends and family. So in the spirit of American Heart Month, here are some things that we can consider as we are preparing and welcoming folks over. So firstly, try to or consider prepping using like fresh whole food ingredients. Try to avoid those kind of prepackaged or frozen foods. Next is try to consider centering healthy and delicious fruits and vegetables as part of your appetizers, dips, and entrees, that sort of thing. And then if you're serving meat for guests, want to consider offering a seafood option or a chicken option. When you're in the kitchen and thinking about oils and cooking, you want to opt for the extra virgin olive oil as opposed to butter or some of the other vegetable oils as well. On the dairy side, if you're preparing a dairy-based dish or app, you want to try and use the low-fat options. And then take a look at the labels, especially if you've got high blood pressure and other chronic diseases. You want to try and grab things that have low or no added salt, those sorts of things. And then it's always good practice to check in with your guests to see about any food allergies and or any food restrictions.
I'm going to be honest, it's going to be really hard for me to eat healthy on Super Bowl Sunday. Usually a Super Bowl is like pizza, chicken wings. I'll throw some celery in there, all the dips. So,
and maybe beer, something along those lines.
Sure. No, I'm with you. Just considering a few other options to
mix in some fresh fruit.
Right.
Moderation, right?
No doubt.
Right.
All right. What are school-based health centers and how can they improve health?
So it is National School-Based Healthcare Awareness Month. And so these school-based health centers are often partnerships between school districts and healthcare organizations that come together to deliver primary care services on or near school campuses. So in that way, they're helping reduce barriers to access, mitigating things like issues with transportation to bring healthcare services directly to children, school staff, their families, and the surrounding community. And these clinics can provide things that you would expect to receive at your doctor's office. So your annual well checks, immunizations, they can care for things like cough, congestion, runny nose, chronic disease management for things like asthma, obesity, hypertension, diabetes, referrals to specialty services, screenings for mental health conditions, and connections to services as well. And beyond just delivering like high quality healthcare services, these school-based health centers have also been shown to help schools reduce absenteeism and missed days from school, promote or boost graduation rates, and even help kids get better grades in the classroom.
I'm glad I asked because I've never heard of a school-based health center, so I'm glad to know they're out there.
For sure. There are thousands across the U.S. and several right here in Bexar County.
Okay, I'm not sure I want to know the answer to this next one, but here we go. Can prolonged sitting at work impact my health?
Thank you for the question. A recent study in the Journal for the American Medical Association looked at a couple of groups of folks, those that mostly sit at work and those who mostly don't sit at work. And what they found was that those who mostly spend their time sitting at work are at increased risk of death from all causes, including from things like heart disease. So this suggests that if you mostly sit at work, it might be helpful to exercise a bit more when you're out of the office. So we often discuss here on Doc Talk the recommendations. We know adults should be getting about 150 minutes of exercise every week, or about 30 minutes 5 days a week. So you might want to boost that to about 45 to an hour 5 days a week if you're mostly sitting while at work. So
try to offset that.
It's an important question.
All right, we've got some viewer questions I want to get to now. Is there a cure for tinnitus if I have a very loud ringing mainly in my left ear that's been going on for more than 30 years?
Sure. So let's first talk about what tinnitus is. So this is a condition where patients might experience a ringing or a buzzing in their ears, can affect one or both ears, can come and go or be constant, can even be long-term. And chronic tinnitus we think about as lasting more than 6 months, as in this case here. And the unfortunate truth is that it's unlikely to go away completely, but there are some things that one can do. Definitely want to check in with your doctor, your healthcare team, to rule out any serious medical condition that can be causing this tinnitus. Usually tinnitus is caused by things like hearing loss, can be caused by medications like some antibiotics, other than nerve and blood vessel issues within the ear. So you definitely want to get that evaluation, review your medications with your doctor to see if that might be a potential cause. If you've got the hearing loss, see about potentially the use of hearing aids, which might make things better. And finally, for some folks, getting a specific kind of therapy called cognitive behavioral therapy might be helpful.
Yeah, I've heard of the hearing aids where you can put them at such a frequency they kind of almost cancel out the ringing in the ear.
For sure. And this is affecting about 50 million Americans and roughly 20% of adults right here in the U.S. So definitely a really important question.
Okay, our next one. What causes your sodium levels to drop or to go low?
Sure. So low sodium levels, the medical term for that is called hyponatremia. And there can be several causes of this. First, it's important to know kind of what sodium is. This is an electrolyte. And electrolytes, like sodium, need to maintain a very specific balance in our bodies for us to stay healthy, to function, and to live. And some of the causes of low sodium or hyponatremia are things like heart failure, cirrhosis, kidney disease. Patients might experience things like nausea, vomiting, weakness, cramping, but even more serious things like brain swelling and nerve damage. So if you think that you've got low sodium or you do have, in fact, have low sodium, you definitely want to seek medical attention to address this.
Dr. Lopez, thanks so much for being here.
Of course, thank you for having me.
Appreciate it.
Always great to see you.
Thank you for watching KSAT, and if you're on YouTube, don't forget to like and subscribe to stay up to date with San Antonio's latest news and weather.